I'm Sarah with Speech Therapy, and today we're going to go over some important mealtime considerations that we need to have when we are providing our patients with their trays. First of all, I want to go over the diet levels that we have here. We follow the International Dysphagia Standardized Diet System. So our liquids will be described as either thin, nectar, or honey. Thin liquids will be thin. We don't have to add anything to them. Nectar thickened liquids can also be referred to as mildly thickened liquids. You can do 4 ounces in a cup of any liquid, and you add one of the pink packets of thickener, and it will say mildly thick on the packet. Or if we have the pre-thickened juice or water, it will have a pink stripe at the top, and it will say mildly thickened. If you want to make something honey thick or moderately thick, you use the yellow packet. And then if you get a pre-thickened, it will have a yellow stripe at the top and it will say moderately thickened. As far as meals, sometimes we have patients that have difficulty chewing, difficulty swallowing, so we have to modify the textures of the meals. And those are going to be named by level, but also have a description. So the levels of our diets that we now have are level 4 is pureed. Everything is smooth, like a baby food consistency. So everything should be blended smooth. They should not have to chew at all, just like pudding, mashed potatoes, things like that. Level 5 is minced and moist. So everything is cut into very, very small, finely chopped pieces, but should all have a gravy or something on top of it. Nothing should be dry, nothing should be crumbly. Level 6 is soft and bite-sized. Everything should be cut into small bite-sized cubes and very soft and very easy to chew. This may be some things like tender chicken, soft fish, cooked vegetables, soft fruit, pasta, or rice with some kind of sauce on top. Then we have level 7, and level 7 has 2 different descriptions. You can have a level 7 regular or a level 7 easy to chew. Level 7 easy to chew would be a little bit softer and more tender. And it requires chewing, but you're not allowed to have like very hard, crunchy, or tough foods. And level 7 regular is just a regular diet. There are no restrictions, normal everyday foods. They can eat whatever they want. As far as that's how the diets are going to be described. If we have a patient on a modified diet, I will have it on their whiteboard in the room. And it will talk about, I'll put their liquid consistency, their diet texture, and then if there are any strategies that I want you to follow, whether it is small bites and sips, clear your throat frequently between bites, alternate liquids and solids, I will have that on the board as well. Also, usually if they have thickened liquids, I also have a sign on their door so you can know that, and they will have an orange band on their arm. I just ask that when you bring the meal trays that you make sure the patient is aware that the tray is there. You make sure they're sitting up straight in bed, and that you offer to assist with the setup as much as they need. And then just follow any precautions that you see. If you look at a tray and you see that it's not following the diet that you see the patient is supposed to have, if I'm here, come get me or bring it to the attention of your nurse. Let them know, and we can call and get the right diet sent to the patient. There will be patients that need to be fed, and we will have that on a board in the nurse's station. Also, oral care has been kind of a big deal. We just want to make sure that these people are given access to oral care. So when they're getting a bath, when they wake up in the morning, when they go to bed at night, just like we would do, offer them the chance to brush their teeth, use some mouthwash. You know, they may not be able to get over to their sink, but if you could just bring it to them, and if they need assistance, help them to keep their mouth clean. A clean mouth does prevent a lot of upper respiratory infections. Other than that, if you just follow any mealtime precautions that we have or any recommendations during a meal, and if you see any trouble, any coughing, choking, difficulty chewing, please feel free to reach out to me. I am open to any suggestions, and I appreciate when you let me know that somebody is having trouble. Thank you.